the country began a new week, the government had more grim news. The virus is not slowing down yet.
Today, we have received confirmation of one more case of a patient who has tested positive for coronavirus. This brings the total number of confirmed COVID-19 cases in Kenya to 16.
This was the first case of local transmission in the country, the second stage in the progression of the virus in the country.
The latest is a close contact of one of the 8 cases we reported yesterday. The ministry, working with the county government, has traced 646 persons who had come into close contact with the confirmed cases.
Now the government says it is tracing some 550 people who had contact with some of the patients.
Those remaining in our follow-up list are 550 persons. All the patients, except one, who is at the coast, are still in stable condition and improving.
The government says there is no turning back on the suspension of flights from all international airports effective Wednesday. Anyone who jetted in the country from last night was put under mandatory quarantine, but this has left victims between a rock and a hard place.
We inconvenienced people substantially, and for this we can only apologize and mitigate by saying it was absolutely necessary that we do so.
Many of the passengers who were taken to the Boma Hotel could not afford the high-end hotel rooms and were instead transferred to the Kenya School of Government.
If your normal charges in a hotel room are 12,000 shillings, you should be charging no more than 50% of that or even 25% of that. This is business you didn't expect. Reduce the rate as part of your corporate social responsibility.
The CS recounting the story of one woman in Narok town who flew back from Sweden and was picked from her house and taken to the hospital after she failed to self-quarantine.
Ameenda hakufanya ile self-quarantine kama ilivyotakiwa, na pia anasikia hata alikuwa kwa kanisa. Tumechunguza hiyo maneno na tumechukua hatua. Saa hii tunavyozungumza ako hospitali na atakuwa sasa hapo mpaka 14 days ndio apatiwe clean bill of health.
Kakamega Governor Wycliffe Oparanya putting some of his officers who had traveled abroad on forced quarantine for 14 days. But the greater headache for the fight against the virus is the backlash by the public service vehicle operators who have now increased their fares, piling a further burden on commuters.
And to expect that one sector is going to punish everybody else for them to maintain a scenario where they are earning as much as they could is immoral and unfair. And then therefore we are appealing to the matatu sector to kindly look at the situation, understand it, understand that the commuters they are carrying are not in the same position they were in prior to this. Some of them are not earning any money at the moment, and to appeal for their reasoning.
The CS insisting that every sector must be ready to take a financial hit as the COVID-19 crisis begins to bite. With the government deploying all the arsenals on its disposal to neutralize the new coronavirus in the country, the Ministry of Health now says quarantine is no longer optional but mandatory, telling visitors jetting back to the country to sacrifice at least for 14 days for the sake of over 40 million Kenyans. Stephen Letoo, Citizen TV, Nairobi.